Experts say improving road safety in South Africa requires urgent attention to both human behavior and infrastructure planning, particularly as most road deaths are linked to preventable actions by road users. They say understanding how people move through transport systems is key, especially in a country where public transport, particularly taxis, remains the most widely used mode of travel.
It has been proven that the majority of our country utilizes public transport as a mode of transport, especially the taxi mode. And at the last mile, they use walking, to be able to access economic opportunities, schools, clinics, etc. So we need to be very intentional of how we plan and design around these areas. We need to be very intentional how people access services, and also take into consideration the fact that high speeds kill. People are very vulnerable, so they need to be protected as much as possible.
Experts also say road safety is not only about infrastructure and enforcement, but also about individual responsibility among passengers and drivers. They warn that simply safety practices such as wearing seat belts in public transport are often overlooked, contributing to higher fatalities when crashes occur.
Public transport users, they do not put on seatbelt. So you can maybe say, oh, well, the driver did not say we must put on the seatbelt, but if you take the safety responsibility upon yourself, you would know that restraining yourself in a public vehicle allows you to arrive safely where you're going in case of an accident. And that's part of the reason why public transportation, or rather buses or taxis, when they are involved in a crash, there's higher fatalities. Most of that contributing to it is because people are not restrained. So I think that's, again, even in single vehicle driving, you might find that it's only the driver that puts on a seatbelt.
Road safety specialists say these behavioral patterns contribute significantly to the high number of fatalities on South African roads. They are calling for stronger awareness campaigns and a stricter adherence to the road safety rules, including addressing what they describe as the fatal 5 behaviors.
So we need to really sharpen up. The fatal 5 that we often talk about are speed, impaired driving through drinking, through drugs, or through distraction, for instance, using a cell phone while driving, seatbelt non-use, child restraint non-use, and motorcycle helmet non-use. Now, those fatal 5 kill more people globally than almost any other kind of behavior. So if South Africans would just wake up to those fatal 5 and that we have control over them.
Experts say coordinated interventions between government, engineers and communities are needed to reduce fatalities and improve safety outcomes on South African roads. For SABC News, I'm Luyanda Tanga in Johannesburg.